So you're called code 4 to a private residence for a 45-year-old male complaining of a headache. Fry status unknown.
All right, what's the weather like?
Weather is clear.
And what time of day?
Noon.
Noon? All right, so we're driving up. Not too worried about the weather. We're driving safely. We arrive at the house. Do I see the house? Does it look like I'm going to have any access egress issues?
No, it's a bungalow. No steps or anything like that.
Awesome. So I'm walking up. We're kind of looking around for any hazards, any dogs, any animals. We're walking up to the door. I'm knocking on the door. Does someone answer?
Yeah, and no hazards noticed. The daughter answers the door.
Okay. Hi, my name's Kate. I'm a paramedic student. This is my partner, Liam. Just before we come inside, would you be able to tell me if anyone in your household's had any new or worsening cough, cold, flu-like symptoms or headache?
Yeah, my dad's having a headache.
He has a headache? Okay, so we'll put our gown, goggles, gloves, mask on.
Okay.
So can you take me to your dad?
Yeah, so she does. She takes you into the living room. You find him sort of sitting in a chair.
So I see him in the chair. So I'm looking at our patient now. Do I see any kind of big deadly bleeds anywhere?
No.
All right, so I'm worried about that. And he's sitting up?
Yes, he is.
All right, is he tracking me?
He is.
Can I see obvious breathing?
Yep.
And how's his skin looking?
Looks warm, pink, and dry.
All right. So, hi, sir. My name's Kate. I'm a paramedic student. This is my partner, Liam. What's going on today?
My head just really hurts.
Your head really hurts. Did you fall?
No.
No? All right. So I'm not too. Can rule out C-spine. Can you open your wrist?
He does.
All right. Grab on his wrist. And sir, can you open your mouth?
He does.
What's your name?
Frank.
Frank. And how old are you, Frank?
45.
All right. So I'm looking at his mouth. He's talking to me. Do I know anything that should be any broken teeth, blood,
No.
vomit?
No.
All right. And listening and looking at his chest for breaths.
Yeah, so it's pretty normal breaths, normal rate,
Okay.
full, regular.
And how's his pulse? Rate, rhythm, quality?
Normal, regular,
Okay.
strong.
And how's his skin feeling?
Warm, pink, dry.
All right. And Frank, do you feel like you're wet or bleeding anywhere?
No.
All right. So I'm gonna do a quick head to toe on you. Is that all right?
Yeah.
All right. How's your head, neck, and back feeling today?
My head really hurts.
Your head really hurts. Do you know where you are?
Yeah, I'm at home.
And can you tell me about what time it is?
Yeah, it's around noon, I think.
Do you have any tingling in your hands and feet?
Yeah.
Okay. And have you had any vision changes, hearing changes? Do you feel dizzy at all?
No.
Okay. I'm looking for his face for any facial droop, facial swelling.
Yeah, you note facial droop on the left side.
Okay. And I'm looking for any tracheal tugging, JVD, subcutaneous emphysema.
None noted.
All right. Frank, how's your chest feeling?
Feels okay.
Feels okay. Do you mind if I just move your shirt?
Yeah.
All right, I'm just looking for any kind of med line scarring urticaria.
None noted.
I'm going to take a listen to your lungs. Is that all right?
Yeah.
All right, I'm just going to have to move your shirt. Can you take a nice deep breath for me?
He does.
Breath. I'm just going to come right underneath. Breath. Breath. How are the breaths sounding?
Clear apices to
All right.
bases.
I'm going to place my hands on your upper ribs. Can you take a nice deep breath?
He does. Equal chest reservoir.
Cool. All right. Frank, how's your stomach feeling?
Feels okay.
Have you had any trouble going to the bathroom recently?
No.
Have you felt like you're nauseous at all?
No.
All right, do you mind if can you just lift it up for me?
He does.
All right, I'm taking a look. He's 45, so I'm not worried about a pulse down mass. I'm noting any kind of mottling distension. I'm just going to press on 4 places, Frank. Is that all right?
Okay.
All right, I'm pressing in 4 spots, noting any rigidity, guarding, rebound tenderness.
None noted.
How are your sides feeling?
They feel okay.
They feel okay? And how about your low back?
It feels fine.
All right, how are your hips feeling?
Okay.
Do I know any signs of incontinence?
No.
How are your arms and legs, Frank?
Tingly.
They're tingly. All right, I'm lifting up. Do I see any signs of pedal edema?
No.
Can you press down on my hands?
He does with the right foot. Left foot is weak.
Okay, and can you pull up?
Same thing.
All right, how are your arms, Frank?
Tingly. Yeah.
All right, can you squeeze out your fingers?
Same with the feet. Weak on the left side. Fine on the right.
Okay, and even radials?
Yeah.
Okay. This is Frank. He's 45. He had chief complaint was a headache. He had some tingling in hands and feet. He had facial droop on the left side, and he also had some weakness on the left side. He'd be a stroke bypass, and he was GCS 15.